Watch this.
It's a step in the right direction. The majority of the gem state has now deactivated out of crisis standards of care. We're taking a look back at the strain as we move into a different phase of our new normal. It's one of millions of books that get checked out and returned every day to a library, but this one book was a little behind on its due date, 110 years to be exact. And we've all got our Thanksgiving favorites. For some, it's the turkey. Others, they wait the whole meal to get the pie. Join us now for the Thanksgiving Eve edition of the 208. After weeks and weeks of working through crisis standards of care, this week, most of the state of Idaho finally moved out of crisis standards to a more normal standard, but still not back to normal. Again, this isn't to say that moving out of crisis standards of care means that the COVID situation is roses. I'll tell you, it's not. But it is a sign of a welcome improvement. And for perspective on working through crisis standards and what it means now that we are mostly out of it, today I spoke with hospital staff at St. Alphonsus and St. Luke's Health for perspective. For the first time since September, this week, most of Idaho moved out of crisis standards of care brought on by an aggressive wave of COVID.
The crisis standards of care has been really challenging, obviously, for all of us. And we were fortunate that we never got into a situation where we really had to make a decision who got a ventilator or who got a bed.
Dr. Patrice Burgess is the executive medical director for St. Alphonsus. For about 9 weeks, Dr. Burgess and the St. Alphonsus team across Idaho worked through the most difficult period of the pandemic to date.
Many times people sicker on the regular floor that would normally go to the ICU, but we didn't have enough ICU beds. So we got through all of that, maintaining the best care we possibly could, but that was uncomfortable because we all want to do things, as best as we possibly can. And we were very, very worried that we would be in a situation where we ran out of ventilators or we ran out of space and had to turn people away.
For weeks, frontline medical workers tried to save very sick COVID patients needing intensive care. Some made it, some did not. One word frontline healthcare workers felt really described their situation: helpless. Dr. Brent Duff, medical director for St. Luke's Magic Valley, shares insight on that feeling inside Idaho hospitals.
There's helplessness when you focus in on your inability to change the trajectory of the patient's life. The successes we've seen is when you more focus in on trying to make the best of the situation for the family, and even though you can't treat the patient, you can show empathy for them, and I find that empathy is as much healing as we can offer at this point.
I guess, was there any semblance of relief on Monday when the state announced, okay, most of us are moving out of crisis standards, or did you know, okay, great, crisis standards are over, but it's still very serious here?
It's still very serious. And we knew that we were closing down those additional units. So we have been, cautiously optimistic, but we watch pretty closely our test positivity rate as well as the cases per 100,000 in our community. And we were seeing some improvement in that. Our test positivity rate during the worst part of this surge was up in the 25% range. And if it's less than 5%, you feel like things are not spreading as rapidly and under reasonable control. We got down to 9%, but now we're back up to 10%. So we get a little nervous when we see those numbers jump around. So we'd like to see those numbers improve more and for a longer period before we really feel like we can potentially start to let our guard down.
Yeah, it's still a day to put on my hard hat and get it to work. The numbers are great that they're going down, but we still have patients here in the hospital to take care of, and like I said, there's still the looming specter of COVID all around us. So not much relief to be quite honest, but just happy that less people are suffering from COVID.
Curious if you and your colleagues saw Monday as, a major milestone getting out of crisis standards, or is it more realistically kind of just downgrading the situation slightly, but again, still in a very serious situation?
Yeah, we still see it as a very serious situation. The biggest milestone for us was when the vaccine came out last December. we all, many of us were, tearful with joy and really felt like that was the beginning of the end of the pandemic. And that's the last time I remember seeing as a group of healthcare workers feeling like we were really seeing the light at the end of the tunnel. This particular change is not as dramatic for us, again, because we kind of thought we were done in July, and I think we're all just nervous to let our guard down and get too excited. But there's no doubt it's a good thing. It's a good thing that we have more beds available and that we're not in non-traditional areas for care, pulling in people from other areas to help. That's definitely a good thing.
There's a sigh of relief, but at the same time, we still have quite a few high numbers of patients here in the hospital than what we're accustomed to at this time of year. And so we now don't have that same protection that we did as we try to provide the best care possible, but at a more of a contingency level of care instead of a crisis level.
Well, what can you say about your coworkers inside the hospital and the work that they've done over the last several weeks and several months? I know that saying it's difficult is really an understatement.
I couldn't be more proud and more blessed to work with the physicians, the nurses, the respiratory therapists, the environmental services, the phlebotomists that I've worked with over these last 4 months and 18 months since COVID really started. They continue to show up and work extra hard. The relationships that we've built through this pandemic, my hope is that these will be very special ones that we'll continue to have throughout our lives.
Well, you heard the medical experts allude to this. Just because the majority of the state is leaving crisis standards, again, that doesn't mean we're out of the woods just yet. So before we gather to celebrate with our families tomorrow, state officials here in Idaho are still urging everyone to please take precautions. This week on an AARP town hall call, Governor Brad Little said while our state numbers are trending down, getting vaccinated is the best way to help everyone, especially those who have been fighting COVID since the beginning of the pandemic.
Remember the healthcare workers that are on the front line all during this last 20-some months. What they, their families, their co-workers have been through, that when you're giving thanks to your family this week, think about those people that have been so important to maintaining the safety and the health of all the people of Idaho.
Department of Health and Welfare Director Dave Jepson was also speaking to Idaho this week. He urged all Idahoans to go get their booster shots to prepare for being around more people during the holidays. Jepson also says it's not too late to get a booster before Thanksgiving. And he says while full protection occurs 2 weeks after it's given, some immunity starts right away. So before you head to your family's dinner table, remember, think of what you can do to be COVID conscious. The idea here from medical experts is to prevent a big spread following holidays like Thanksgiving when many people get together. And speaking of looking out for others, we wanted to mention this. The 7 Cares Coat Drive is in still full swing right now. And the 208 team and Channel 7 are on a mission to help everyone stay warm this winter. So all month long, you can get out there and donate a new coat to someone in need. Just drop off the coat in a collection bin at any of the Fred Meyers in the Treasure Valley, as well as in Twin Falls. And now that we're in the holiday season, that means it's time for us to kick off 7 Cares Idaho Shares. It's a great campaign every year. Now, the annual event is a community campaign aimed at helping our fellow Idahoans by getting them much needed food and supplies ahead of the winter. Last year's event raised over $950,000 for local charities and nonprofits. You can begin making your donations virtually this Monday, November 29th. We've seen all your emails and calls and texts. 7 Cares is on the way. Well, still to come here on the 208, the strict librarian stereotype is a Hollywood favorite, but how about a surprised one? That was the scene at the library on Capitol in Boise when they came across a returned book that was checked out longer than any of them had been alive. And we may not have as much knowledge as your local library, but we've been known to dabble in doing our research. So ask us your questions and we'll get out there and find you the answer. We also love to see your comments. We read all of them. If you'd like to interact with us, text us right now, 208-321-5614. Make sure to include your name in the hashtag to 208 so we know who we're talking with. All right, be honest. Have you ever checked out a book from the library and just totally forgot about it? Or maybe you liked a book so much you just kept putting it off to return it. Well, whatever the reason, the library has probably seen their share of forgotten books before. But the Boise Library checks in 3,000 to 4,000 books every single day. So they've got a real close eye on their collection. Usually it's a drop-off, stick it right back on the shelf. You know the process. But one recent book halted that routine, forcing librarians to do a double, triple, quadruple take on the due date. A book checked out 110 years ago in 1911 was just returned last week. Katya Stepovic has the story.
As readers drop off their finished books, Ed Harvey is on the other side of the wall, checking them in. Nearly 3,000 of them, daily.
There were all these checkout due dates here.
But one book in particular caught librarians by surprise last week.
November 8th of 1911, I think, was its last due date. The checkout desk downstairs noticed that it was rather old and it didn't have any current markings. So they looked into it and sent it up to the director, and then kind of went on from there.
New Chronicles of Rebecca, a sequel to Rebecca of Sunnybrook Farm by Kate Wiggin, was published in 1907. It was checked out of the old Boise Carnegie Library in 1911, only to be returned 110 years later.
I don't think anybody here has seen a book checked in 100 years later.
While it's not the oldest book in the library,
This one is 1893.
it's the years that the book spent off the library shelves that catch people by surprise.
You've got 1910, you've got fresh dates there, so I'm guessing it came in at about 1909. And then it was obviously checked out and then gone.
The pages are still crisp, words still legible, and pictures crystal clear.
It's in great shape. Yeah, it's in really good shape. I think the condition would be very good to excellent.
But what about the late fee that the years have probably racked up?
Books may be kept 2 weeks without renewal unless otherwise labeled. A fine of 2 cents per day is imposed on overdue books.
At more than 40,000 days late, if the library still had the same late fee policy, whoever checked it out would owe more than $800. But not anymore.
The book was originally $1.50, and so that would have been the cost that we would have charged. We never charged more than the cost of the book for the fine.
The New Chronicles of Rebecca, valued today at $5, can surely illustrate the tale of a heroine. But what it can't tell you is the story about where it's been.
You know, unless somebody, wants to come forward and be like, hey, this was my grandmother's and she moved to, wherever and, was always embarrassed that she hadn't returned this book or something. It would be great if we could find out what happened. But that said, sometimes there are just mysteries in history.
Well, Katya, your story leads me to the next logical question. What happens to the book? Does it just go right back on the shelf? It seems like it's too valuable now.
A little too valuable, I will say. New Chronicles of Rebecca is now a little bit of Boise Public Library's piece of history, if you will. So they're going to hold on to it, put it in their history room. People can still come look at it, touch it, feel it, read excerpts from it, whatever they want to do, but they can't check it out. But that being said, it's not very expensive, $5 online, so they can go grab it if they want. But what we really want to know is who was involved in this check-in, check-out process. So viewers at home, reach out to us because this is a amazing story.
Somebody's got to know where that book's been for 100 years. You're not in trouble either, so anyways.
Not at all.
Katya, thank you for the story. Well, we know it's a time to gather together and give thanks, but we all know we're also gathering to feast on that fabulous Thanksgiving food. So we tried to settle the debate on the best of Thanksgiving by bringing in the kids. Of course, they always have an unfiltered, honest opinion, so stay tuned for that. But we also want to know your unfiltered, honest opinions. Don't be shy. Text us 208-321-5614. Text us your thoughts on the show, a question for the 208, or really anything you want to share. And we will be reading some of your text messages live and in full color here at the end of the show. The fourth Thursday in November is traditionally the day the United States celebrates Thanksgiving, and we say the U.S. because it really is only here. In Canada, they do have a Thanksgiving. It's in October. It has nothing to do with us. Anyways, for those of us residing in America, it's almost time to put your loosest clothing so that you can get ready to tackle that turkey. You got to make plenty of room, right? But have you ever wondered, why are we eating turkey? Why is turkey so synonymous with pilgrims and the first Thanksgiving back in 1621? We asked that because, as it turns out, there might not have even been a turkey on the first holiday table. And guess this, NBC News actually had the same question we had, and so they checked in with Ashley Rose Young, and that's the historian with the Smithsonian's National Museum of American History. That's the source. So they tell us that the meats likely shared between the Pilgrims and the Native Americans: venison, geese, and duck. No turkey. So how did turkey make its way into the Thanksgiving grocery list? It's a great question. Well, our friends over at Britannica, the encyclopedia that has everything, they tell us the idea of turkeys on Thanksgiving could have been because of a writer named Sarah Hale. In her 1827 novel, Northwood, Hale spent an entire chapter detailing a New England Thanksgiving, complete with a turkey at the head of the table. Turkeys are native to North America, and back then there were a lot of them. And that particular bird set the American table apart from that of the British table. And more people were able to get their hands on those turkeys, and they bring the nation together with shared food on a shared holiday. Perfect equation, right? Plus, turkeys, they're big enough to feed a lot of people all at once, and the author Hale also advocated for Thanksgiving to be a national holiday, as the country was on the brink of a civil war at the time. President Abraham Lincoln finally did proclaim the Thanksgiving holiday in 1863. So while there is no proof of a turkey on Thanksgiving in 1621, the affordability, convenience, and the really sheer word of mouth cemented the holiday legacy for, you got it, the turkeys on Thanksgiving. And turkey, of course, Thanksgiving tradition, but is it a holiday favorite for everyone? Turkey does have some tough competition. I mean, who can say no to pumpkin pie, right? Mac and cheese, yams, mashed potatoes, green beans, gravy, whatever you got there. Turns out there's some pretty harsh critiques for potatoes in the gem state right here. Can you believe this? And a lot of the critics of potatoes on Thanksgiving, they go to Greenhurst Elementary School. So in a pre-holiday anticipation, our Brian Holmes and photojournalist Kevin Esslinger, they went out to Nampa to talk to the kids to find out what they're most excited for and also what they're not excited to see on their table tomorrow.
Do you like Thanksgiving? What do you like about Thanksgiving?
You get to eat yummy food.
You do get to eat yummy food. What's your favorite thing to eat on Thanksgiving?
Turkeys.
Turkeys? What's your least favorite? What do you not like to eat on Thanksgiving?
Nothing.
You like it all? Nice. What's your favorite?
Turkey.
Turkey? All right. Do you have one that's not so much your favorite?
Mm-hmm.
What?
Mashed potatoes.
You don't like the mashed potatoes?
Mm-hmm.
Why not?
Well, I do like them when they're mashed and baked.
Oh, you like that little extra effort you put into them.
Mm-hmm.
Gotcha. Is there something you don't like so much?
Mashed potatoes.
Mashed potatoes? Really? Why not?
I don't know. Potatoes.
No potatoes. Why not?
They're like mushy. I don't like potatoes.
And what do you not like?
Hash browns.
Hash browns. Okay, so back on the potato thing. Why don't you like the hash browns?
Because they have potatoes in them.
All right. You know you live in Idaho, right? You're supposed to like potatoes.
I don't like pumpkin pie.
What? Why not?
Because it doesn't have what I like in it.
What should be in pumpkin pie?
Pumpkin seeds.
Pumpkin seeds, okay.
It's not Thanksgiving without turkey.
It's not?
No.
What if you don't like turkey?
I love everything.
Everything? What's your favorite?
Everything?
Everything. And there's nothing you don't like?
Nope. I love everything.
Do you like to eat on Thanksgiving?
Yes.
All right. What do you like to eat? What does your family eat?
Steak and turkey.
Steak and turkey. Wow, that's awesome. Would you have a favorite food?
No, I don't.
None? Mm-mm. Nothing stands out? Not even dessert? Mm-mm. Really? Do you have a favorite food?
The stuffing.
The stuffing. That's a good one. That is a good one. Do you have a one that you kind of like, shy away from?
Pumpkin pie.
Wait a second, what? You don't like pumpkin pie? Why not?
I just don't like it.
Really? Do you like Thanksgiving?
Yeah.
What about it?
The feast.
The feast. Like what part of the feast?
The sweet potato and dessert.
What's your least favorite Thanksgiving?
Favorite stuffing?
You don't like the stuffing?
No.
Why not?
I don't know. It just gives me that vibe. Like,
Do you have a favorite food for Thanksgiving?
deviled eggs.
Deviled eggs. Wow. All right, that's a good one. What do you not like about Thanksgiving, the food?
Stuffing?
Stuffing. Not a lot of people like stuffing.
No.
Do you like Thanksgiving?
No.
Why not?
Because of pumpkin pie.
Well, hold on. You don't like pumpkin pie.
Yes.
Why not?
Because when you have the pumpkin pie tastes like pumpkins. Because I tried a pumpkin before and it tastes like that.
Oh, yeah. Do you have a favorite Thanksgiving food?
Yeah.
What is it?
Steak.
Steak.
Yeah.
Wow, very non-traditional.
Yeah.
All right.
For dessert, I eat a chocolate cake.
Chocolate cake.
Yeah, and my favorite thing is the pumpkin pie with the whipped cream on top.
Wow, chocolate cake and pumpkin pie? That's a good dessert right there. Do you have a favorite food at Thanksgiving?
Pumpkin pie.
Pumpkin pie.
It's delicious.
It's the best.
Yeah.
Do you eat it with whipped cream?
Yes.
Like a lot of whipped cream?
And I also like apple pie. It was my papa's favorite.
Oh, nice.
He passed when I was 1.
Oh,
But that's okay because I still have him in here.
you have a lot to be thankful for.
Yeah.
Well, thanks for joining us here on your Wednesday. The 208 is going to step away for the rest of the week, but we will be back next week. A lot to be thankful out there, so thank you to all of you for joining us. Big shout out to Mo at home. I know everyone wants to see Mo soon. He'll be here.